Hi, this is Dr. Jenny Byrne. I'm an adult psychiatrist in Chapel Hill, North Carolina, and today I wanted to talk to you a little bit about things not to say to someone who is depressed. Um, this is a tricky subject. We all, or most of us, have known someone that's been severely depressed some point in their life, and we want to help, especially if it's a loved one, and we want to say the right thing. So, here are 5 ideas about things you should try to avoid saying, and I'll explain a little bit why. The first thing I would avoid saying is that everyone has bad days. Sometimes people say this to try to show their empathy or that they understand, but depression, real clinical depression, is different than a bad day. Um, Typically, it lasts for 2 weeks at least. You have a lot of symptoms associated with it. Yes, it's definitely true. Everyone has bad days, but this is more than just a bad day. So when you say that, maybe you're trying to be helpful, but it comes off maybe that you don't really understand. Number two thing, try to avoid saying, is that this will get better. That may be true even with episodes of clinical depression. If you give it long enough, a couple months or a year, it sometimes will get better on its own. But often it won't. And having some help to get through it, whether that be talking with someone, some therapy, medication, whatever is the best treatment option, that will really speed recovery. So just saying this will get better on its own, yes, it might, but that might take months or even years, and that's really a long time to be depressed. Okay, number three, this is a real common one. People say, I understand what you are going through. And again, they're saying this to try to be empathetic and be sympathetic and understanding and warm. But if you haven't been clinically depressed, you probably don't really understand what they're going through. And even if you have been clinically depressed, what it felt like for you might be different than what it felt like for them. So saying that you understand isn't really the most helpful. You could always say, help me understand, or tell me what it's like, or an open-ended question like that. That's going to be much more productive. Number four, I've heard this one before. You just need to snap out of it. That's not really very helpful. Obviously, they can't just snap out of it, or they probably would have by now. I think when people say things like that, it comes from a background where, maybe the family wasn't encouraged to talk about feelings, or just that's kind of their personality. But that comes across as very harsh, and sometimes a little bit judgmental. So I would definitely avoid saying that. And then number five, this one I hear a lot, is kind of, well, think about all the good things in your life. And this is said in a, again, trying to be helpful way, that if the person is depressed and they think about good things in their life, they'll feel better. And this may have a little grain of truth in it. You can feel better. But with depression, often what you see is that people have distorted thoughts, meaning that they tend to overemphasize the negative in everything, and just pointing out the positive typically won't overcome those thought distortions. So again, with treatment, either with talking or cognitive behavior therapy or medicine, those thought distortions tend to change, and that's when they're able to really process positive as well as negative. So just a quick review. Number one, everyone has bad days. Number two, this will get better. Number three, I understand what you're going through. Number four, you just need to snap out of it. And number five, just think about all the good things. So I hope this was helpful. If you have any questions or comments, please see our contact information below at Cognitive Psychiatry of Chapel Hill. Thank you.